prevalence of COPD is about 10% of the population over the age of 40 years. So if you take COPD as a broad group, it probably affects about 10 million people in the UK. With emphysema, as I mentioned, you get this hyperinflation. So the lung gets overexpanded. That in turn stops the diaphragm from working properly, and the diaphragm is splintered. So one way we can reduce the volume of that lung is by putting a valve in which allows air to escape from the lung but not to go back in. And if you're able to completely segregate a lobe of the lung with 3, 4, or 5 valves, then that lobe allows the air to come out and therefore shrinks and thereby reduces the lung volume. We probably treated well over 500, maybe up to 750 patients in the UK with severe emphysema with endobronchial valves. And a lot of these patients basically used to either be on oxygen, or they're very limited in terms of their mobility. They're only able to walk very short distances before they had to stop. They tend to lose their weight, and also just minimal tasks were making them absolutely shattered and exhausted. So they had very poor quality of life. And what we've seen with endobronchial valves is what I would describe as life-changing improvements. When some of these patients improve, they get massive improvements. Their lung function improves by about 30%. They're able to walk again. They're able to comfortably go outside. So not only are we giving them improvements in their lung capacity, what we're really giving them is their dignity and their function back. The GOLD guidelines are international guidelines that are respected by all physicians all around the world. And in 2023, what we really got was the GOLD guidelines were adapted so that they saw endobronchial valves for the treatment of emphysema as GOLD level A evidence. So that's the highest quality evidence to say that this therapy works, and it improves their quality of life, it improves their lung function, it improves their exercise capacity, and it also has a survival benefit. So really work hard in trying to identify these patients, recognizing these patients, and then send them to the local hospital for treatment.